One of the challenges that we have in public health is when everything's working well, that people aren't sick and they're not experiencing illness. And so they don't even know that they've benefited from public health. And I think cervical cancer is probably a good example of this. The news, for example, when the new cervical cancer screening was rolled out, there were people who were coming forward and saying, my life has been impacted by this because my cervical cancer was detected early through this new cervical cancer screening. But we don't necessarily hear from all of the people who were vaccinated against HPV, and so therefore they will never have to be screened and actually be at risk of cervical cancer. All of the people who have never had an illness have no idea about how many times they might have potentially been exposed or might have developed that illness, but they were protected because they were vaccinated. So I think that's one of the difficulties for public health is helping everybody understand that all of these things that are happening quietly in the background, they're all essential for us to all have the health and wellness that we enjoy.